You're watching CTOM TV. Knowledge is power.
So I think we have a plan for today. I think that is going to be a good way of going over this.
Okay.
First off, we're going to talk about the different questions you need to ask your doctor when you have a cancer diagnosis.
Okay.
And we're going to cover first the diagnosis, then the treatment, and then the monitoring, and then we're going to talk about clinical trials. And then after we finished, I'm going to ask you 5 questions, Michelle and the audience, and you can do your best to answer. And then we will go over each question in detail, and I will give you an explanation of how best to answer that question.
Oh, crap. There's a
So
quiz.
there will be a quiz at the end of it.
There's a quiz.
And then we will answer your questions as posted on the internet.
All right. I'm taking notes, as always, but extra
So
notes
take
now,
notes.
now that I know there's a quiz. Okay. So you said you want to talk about diagnosis,
Yes.
treatment, monitoring how well the
Yeah,
treatment's working, and then
exactly.
clinical trials.
Exactly.
Okay, folks, have your pen and paper handy, prepared to ace this quiz. Let's go.
Okay, so diagnosis.
Okay.
You've just been diagnosed with a cancer.
Okay.
What do? The first thing you want to do is get your medical records. You want to ask your doctor for all of your medical records whenever you go in for a doctor's visit. And in certain places like Canada, a lot of the medical records are still hard copy and go through traditional faxes that go through actual phone modems.
Right.
So you want to have your records in hand, because a lot of times when you go see a specialist, they're not going to have all of your medical records. So you want to bring them with you. So that's the first take home. Now, the thing you want to ask your doctor, if you've been diagnosed, you want to say what tools you use for diagnosis. So typically that's going to include a pathology, which looks at the cells through a microscope and uses various stains to determine the tissue of origin and ensure that they have the accurate diagnosis of the primary. And then there's also going to be some imaging. And then you want to know what sort of blood work has been done. You know, have they looked at any tumor markers or, certain factors in the blood that can indicate that you have cancer?
Mm.
Then the second question you want to ask your doctor is there any potential for confusion on this diagnosis? In other words, are there other cancers that could also have these same sort of pathology markers or blood markers or imaging? This does happen quite a bit. So you want to ask that just to be sure, just to be on the safe side, if there is a potential confusion or a potential alternate hypothesis for what you have. Then you want to ask about molecular profiling. And one example of molecular profiling is for breast cancers. So if you have a breast cancer, they're typically divided into 3 different surface receptors. And these surface receptors are the estrogen receptor, the progesterone receptor, and the HER2 receptor. So in a lot of cases, they will give you a percentage of the cells. You want to know that. You want to know if you're strongly estrogen positive or only weakly estrogen positive. You want to know if you're PR strong or not. You also want to know if you're strongly HER2 positive or not. And so you can be estrogen positive. You can be estrogen and progesterone positive. You can be estrogen and progesterone and HER2 positive, which is called triple positive, or you can be triple negative, or you can be HER2 only. So importantly, find out, what molecular features your cancer has. And for example, what percentage of the cells have estrogen receptor positivity? Is it 50%? Is it 90%? If you have HER2, for example, what you want to do is ask, was that IHC, immunohistochemistry, or was that from fluorescent in situ hybridization-based technology, which is a much more accurate way for determining HER2. A lot of times the pathology will be just IHC, and they won't do the FISH. So definitely request the FISH if there is any sort of HER2 expression whatsoever. Now the fourth thing you want to ask about is tumor DNA sequencing. And this is very important because more and more cancers are now being sequenced for certain indications. A lot of the times, what they look for is they'll do a targeted mutation testing to see if you have mutations that will prevent certain drugs from working. One example would be KRAS testing or BRAF testing for colorectal cancers. If you have either of those, then EGFR inhibitors are not going to be beneficial for you. So ask if there's been any tumor DNA sequencing done whatsoever. And if there is, get that information. And then you also want to ask about microsatellite instability, which is a type of tumor that is highly genetically unstable, and also mismatch repair testing. Those are referred to as MSI and MMR, respectively. And what they refer to is mismatch repair is a combination of DNA repair genes, and when they see a mismatch in the base pairs of the DNA, they repair it. So if they're faulty, they're not going to be able to do that, and your tumors are going to have a high number of mutations. And so you also want to look for tumor mutation burden. So if you have a high amount of tumor mutations, together, all three of those tests will indicate whether immunotherapy is going to be a benefit to you. Immunotherapy such as CTLA-4 inhibitors or PD-1 inhibitors. Very important because the FDA has determined that anybody, regardless of the type of cancer, that has an MSI high or MMR should get immune therapy. It seems to work in just about every cancer that has those features. So always check and see if that has been done. And if not, request it and offer to pay for it out of pocket. And then finally, if you have a cancer and you're under 50 years old, you want to ask about inherited genetic testing. It's a cheap, easy way of finding out if you have genetic mutations that cause susceptibility. And often, doctors will look at family history and so on, but that's not always the case. You can have mutations in the sperm or the egg that is just a one-shot deal, very much like what you'd get with something like Down syndrome or some of the genetic diseases that are common and involve cancer-related genes. Neurofibromatosis is one of them. And so you want to find out if you have any of these inherited genes, because they can also lead to potential treatment options. For example, if you have mutations in BRCA1 or 2, with a lot of different cancers, you can get PARP inhibitors now for those mutations. So in regards to treatment, we're going to go into treatment now. This is the second section. The questions you want to ask your doctor. Your doctor has given you a diagnosis now, and now they're going to give you a treatment, and they're going to say, here's what we suggest is the first standard care, and it's going to be based on your stage and your type of cancer. So what you want to do is you want to ask your doctor, you want to say, okay, you're giving me this treatment protocol. Now, please tell me the data on this treatment. I would like to see a clinical trial data that shows me the overall response rate. The overall response rate refers to how many patients in that trial have responded to that drug. So if you have a trial of 100 patients and 13 patients respond to that drug, then that means that you have an overall response rate of 13%. That's a very important thing to understand. Then you want to understand what your progression-free survival is. And that refers to the duration of time that a patient is on a drug before the disease reoccurs. And once again, that is a median, so it's a statistic. And so what they do, if they have a trial of 100 patients, and what they do is they give the 100 patients this drug, when 50% of those patients get disease recurrence, they mark that time on the calendar, and that is referred to as a progression-free survival rate. And so it will be given in months. And then there's also the overall survival rate. And that is the same sort of thing, but when 50% of the patients in the trial that have been given the drug die. So important things to know. You want to know, you want to have a copy of the study that the doctor is using to show that this is the best treatment for you. And that is the statistical data you want to understand. And then you want to ask for the peer review studies on that, because that will give you a good indication on how old the treatment actually is. Is it a treatment from 15 years ago? Is it a treatment from 5 years ago? Have they updated this treatment in all that time? Having a study in your hand really gives you a good indication of all of this. And the doctor should provide you with that. The third question you want to ask is, are there any available targeted therapies? And targeted therapies would be based on specific mutations. So let's say you have colon cancer and they tested you and you have a BRAF positive cancer. Your doctor tells you, well, you do have this BRAF mutation, so we can't give you an EGFR inhibitor. But what we now know is that if you have a BRAF mutation, you have colorectal cancer, there's a triplet combination that includes 3 different targeted drugs that works incredibly well for patients with BRAF mutations. Because normally if you have this BRAF mutation, it's a very dire consequence with standard chemotherapy. So you want to ask about these targeted therapy options that are available based on the mutations you have. And then you want to ask if immune therapy is an option. Once again, this boils back down to your MSI, your MMR, and your tumor mutation burden, as well as certain mutations such as ATM or the BRCA mutations or high PD-1 expression, which can all determine whether you're going to be a candidate for immune therapy, PD-1 inhibitors or CTLA-4 inhibitors. And then you want to ask your doctor, are there any clinical trials? And so what you do if the doctor says, I'm not sure, because there are no real ways that doctors have access to clinical trials. There's no one navigating these for them, and it's very difficult for them to spend the time to look for them. So what you do is you go to a website called clinicaltrials.gov, G-O-V. You type in your cancer, and you do a massive search, and this will give you all of the clinical trials in the world. Then when you find a clinical trial, you can see whether it's being offered at a hospital near to you, and you can print that out and take that information to your doctor and say, I'm interested in this trial. It's apparently a great drug, and there could be potential for that should my chemotherapy fail. Then what you want to do is you want to ask if there's any off-label drugs. In other words, are there drugs that target a specific mutation in a different cancer than what I have, but target the mutation that is in my cancer? So for example, let's say you have a triple negative breast cancer and you find out that you have the androgen receptor on your tumors. The androgen receptor is normally expressed in prostate cancers. But if you have high androgen receptor on your triple negative breast cancer, then that means the treatment for prostate cancers, while it may be off-label because it's indicated for prostate cancers, may be beneficial to you. And we've actually seen patients treated with triple negative androgen receptor breast cancer getting prostate cancer protocols and doing incredibly well on them. So that is referred to as off-label drugs. An off-label drug is a drug that is FDA approved, but it's approved for a different type of cancer other than the cancer you have. But you have a mutation, and that drug targets that mutation regardless of what type of cancer it is. It just hasn't been tested in your type of cancer as of yet. Then you want to ask, for these drugs, is there an option to self-pay? You want to know what your options are, because a lot of times doctors will only give you options that are covered there at that hospital. So there could be a really good drug available, but it's too expensive and it's not covered yet by Health Canada or your insurer. So you want to ask if the doctor knows about any of these drugs. Then you want to ask your doctor, what is being done in other countries? Is this the same standard therapy all across the board? What are they doing at the Mayo Clinic for this cancer? What are they doing at Sloan Kettering or MD Anderson? Or what are they doing in the European Union? You want to find out what else is going on in different countries, and you want to know if your doctor is aware of this. And that's very important information because it can give you a good indication of whether you need to get a second opinion or need to see a different doctor. And then finally, you want to ask your doctor, are they aware of any case studies done through different oncologists? So what case studies are? They're individual drug treatment protocols that oncologists have used on patients and that have gotten good results. They're off-label typically, and they're unique combinations of drugs that wouldn't normally be used in that type of cancer, but an oncologist has found that it's worked really well in a patient that has that type of cancer that you have with the same molecular markers and same genetic features, and whether that case study would benefit you. And so case study is usually restricted to 1 or 2 patients. So it's like a mini clinical trial done by a doctor. So you want to ask your doctor if he's aware of any case studies involving situations that are similar to you.
Thank you for watching CTOM TV. Subscribe below and stay informed.